This episode of the Seniors Flourish podcast is brought to you by the Learning Lab membership, because I get it. I was working with older adults in home health when I started out, and I was the only OT practitioner. I was new, I had no mentorship, I struggled with the little things at work, and I was so incredibly overwhelmed. I was struggling to keep up with that paperwork, and because I was working such ridiculously long hours, trying to research best practice, find all the patient handouts I needed, I just couldn't keep up with it all. And the worst part is I was constantly doubting myself. Am I really doing what's best for my new patients? That's why I created the Learning Lab, because I desperately needed a way to get organized and have everything I needed at my fingertips. So it's cheaper than a textbook, but it has hundreds of treatment idea videos, patient handouts, evidence-based resources, and more right at your fingertips when you need it. So join today at seniorsflourish.com/Learning Lab.
Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
Welcome everyone to the Seniors Flourish podcast. My name is Mandy Chamberlain. I'm an occupational therapist, and on the show, we like to talk about everything having to do with occupational therapy. So I am so glad you're here, and I am very excited about my guest, Terri Cassidy. She's an occupational therapist and a certified driving rehab specialist, and we are going to be talking about basically helping our patients transition into driving retirement. It's kind of a funny story, Terri, because probably in 2016, I presented my first time at the Colorado OT State Association, and I went to your course, like your presentation about driving. And I think I tried to do I think there was two or three that year about driving, because I was like, oh my gosh, in rural side of Colorado, there's not a lot of driving rehab specialists, and we're always kind of struggling, what's our role? What can we do as generalists and that kind of thing. So then I just kind of started following you and checking out all your cool driving stuff. You're like the OT driving unicorn of You're probably
wow.
No, I gave you a new title, like the OT driving unicorn.
I've never had that introduction before.
You know what? It's a first time for everything. So no, but I just love all your stuff. So I'm so excited about driving retirement, because I honestly didn't realize that it was, you always know about OT and driving, but driving retirement to me is a whole nother level. Just something I never really did. So I'm glad we're going to talk about that. So thanks for being here.
Awesome. Thanks so much for having me.
Well, let's just talk about how you got into OT and just kind of where you are now, your little OT journey.
Okay, sure. Thank you. So let's see. I didn't discover OT until after I had my undergraduate degree, and I was working in scientific consulting and really wanted to do something more people focused and hands-on, and just didn't really know OT existed. And I actually started volunteering at a hospital in there, shadowing a physical therapist was my thought. And I met this incredible OT, and this was an acute care hospital. And she was just amazing. And I ended up spending all of my time with her. And I just loved the holistic piece of it, the fact that we were addressing cognition and we're addressing function. And I was totally hooked just from that experience. So that was really what got me started on my journey of OT school and career.
Gosh. And so then currently, talk a little bit about, because I think it's super interesting. What do you do currently?
Good question. And it depends. It depends a little bit on the day.
Yeah.
But yes, so I spent a long time working in a hospital system, and then in October started my own business. So this is all pretty new for me in this respect. Doing driver rehab services in a private practice setting. But then also I have grant funding through the Colorado Department of Transportation to really address older driver risk, older driver awareness, a little bit more on a public health level. So a lot of my focus is trying to educate medical professionals, primarily OTs, and build capacity of occupational therapists to address potential risks related to driving with our clients.
So cool. It
So
really
fun.
is. Oh, I bet it is fun. I bet the adventures of actually being a driving rehab specialist you have lots of stories. Like,
That is true. That
well,
is
because,
true.
a long time ago when I did my like level 2, I was at like a outpatient neuro head injury kind of facility, and there was a driving, and my clinical instructor was also a driving rehab specialist. So that's kind of like how I kind of learned a little bit more about it instead of just textbook, the firsthand experience. But gosh, I haven't done anything since
Nice.
then. So yeah, but I even have stories from like 17 years ago. Like I still remember, I was like, oh my gosh.
They stick with you, don't they?
They really do. So let's just start out with like, how do you define driving retirement? And like, why is this such an important topic for OTs?
Sure. So I'm really excited kind of to introduce this term. It's not something a lot of people are familiar with, like the idea of driving retirement. But to me, it really represents a shift in the way that we can be addressing driving. So if you think of retirement, it's something usually that's planned. And so that's kind of the key difference. So, and it's something people can relate to. So you think of retirement from work. You don't just show up one day and say, I'm not working anymore. I don't know what's going to happen in the future. I don't know how I'm going to afford anything. I'm just done. I mean, maybe some people do, but generally it's not planned out. So the idea of driving being something that we can anticipate, maybe even look forward to the day when we're not responsible for that anymore, shifts how we think about giving up driving. And I think that the big thing to me is it's going to take a societal shift to really get there. So many people still think of driving as an individual decision, and in a lot of ways it is. But as an entire society, there's things we can do to make this process more normal and accepted. So yeah, in terms of OT practitioners, I really see so much of our skill at assisting people with transitions in life, whether that's because of a disability, because of, a million different reasons. That's often the times when OTs are called in to action, I suppose. And so driving retirement is often in correlation with other physical changes. There's usually reasons that needs to happen. And so a lot of times OT practitioners are working with these individuals anyway, maybe after a stroke or maybe somebody with early stages of dementia. And I think we can really add value to what we bring to our clients by also addressing driving and changes with driving.
Yeah. Yeah, like I was saying, like I went to a course on that, a couple of years ago, and I just never really, I actually never really thought about having a key role in that, and like it really did shift. It was like a mind shift for me as well, like saying like, okay, yeah, it's not just quitting; it's maybe having a plan or looking at the other options or. Before I mean, I can honestly say I might have been like, okay, here's maybe let's work on like a bus schedule or something, which may be a part of the plan.
Sure.
But I didn't really think of it more holistically or as a transition, I guess, of life. Like, that people, it's very hard for people to quit driving if they are, need to, and they choose not to, you know what I mean? Like,
right.
because of a limitation. And so it's just, I don't know. I didn't really think of it like that before. So I thought that, I think the whole idea of driving retirement is really cool. And I think we could obviously play a huge role in that. So how does, so let's just kind of back up a little bit and talk about like, how does aging, impact driving and getting to that point? Yeah.
Yeah. And I think if we stop and think about it, there's a lot of things that we're assessing with our clients. So we're looking at vision, we're looking at their physical capabilities, we're looking at cognition. All of these things impact driving. I think of driving as like, for a lot of our clients, it's the most complex ideal activity that they're doing. most likely. And so oftentimes we don't think about driving that way because it's just something we do. Like it's just a
Right.
means to an end. It just gets us somewhere. And honestly, even sometimes when clients are coming in for a driving evaluation, that's one thing they leave with is an appreciation of all the things that it takes to be a safe driver because we just don't think about it in that way. So really, aging, and everybody's different. And to me, it's really not based on age. It's going to be based on function.
Yeah.
But we know that aging does affect vision, in terms of the amount of light needed, in terms of potential for cataracts, glaucoma, certainly physical skills, maybe major things that might be related to a medical incident, but also things like just general reaction time, neck flexibility, movement of our foot, things that can happen slowly that people don't realize are changing. And then certainly cognition in terms of memory and attention can affect driving.
Yeah. Yeah. It's those changes. And, as you see those people, and I'm sure you see it way more often than I do, working where you work, but, things like people say like, I haven't been driving at night for a long period of time, or, I only drive like during the day or in my town, or like they start slowly limiting their little area of where they are, where they feel comfortable driving. Something they only go to familiar places. They're like, I only go to the grocery store and that's it, or things like that. And that's something that I've noticed just just working from like a generalist standpoint. They'll kind of say things like that, and you're like, well, has anybody looked at your vision, or is anybody, you know what I mean? And they're like, oh, I do it safely.
But people are certainly defensive.
They want to reassure you.
Yeah. But I think that even just being able to have that conversation, like that level of rapport with your client, is a great thing for them to feel comfortable telling you, because sometimes there's people, and of course they're coming to me for a driving evaluation, so they're already a little tense. And then I say, what's your typical driving? Do you restrict your driving in any way? Nope. I do everything. I drive they're very kind of like want to present this front that they don't need any help. Then we go through the whole driving eval where I'm pointing things out, and oftentimes people do well. It's not the type of thing where I'm out there and everybody fails. So that's just an aside.
Right.
But by the end, when we come back and we talk about it, they're saying, well, I really only drive to the grocery store. Or I really you get more of the true picture and some of their insight. And I think supporting self-imposed restrictions, like if someone's telling you that they only drive to these certain places, the more we encourage that, the better. Because that's what I always tell people is the way we stay safe driving longer is by making good decisions. And so I think, having those discussions is key to validating, just like you're saying.
Definitely. Like I also kind of think about like you have those clients that, maybe they have had an acute CVA, or they have, a big change of cognition or physical limitations, and their physician's saying like, you cannot drive, and I know that's not necessarily the same as like driving retirement, where it's I guess I think of driving retirement as a kind of completely done type of.
Okay.
I mean, I don't know. Is that accurate? Do you know what I mean? Like, not necessarily.
I like to think of it as a process.
Oh, okay.
So
that's a good way to think of it.
That's a good question. In terms of, it's a huge shift for somebody to go from driving to not driving.
Yeah.
And so much of where I think we can come in and help is helping people brainstorm before they actually need it. They always say this about alternative transportation. After somebody has a stroke or has dementia, is probably not the best time for them to learn the bus schedule or even if they're strong enough to get up the bus steps or whatever it is. So the more we can help people prepare. So let's say we have a client who's in the hospital for a hip replacement. They're going to recover. The plan is for them to continue driving, but maybe they're not driving for 4 weeks. If we can encourage them to try Uber, try some of these things, but just on a short-term basis and build that familiarity, then when they do need to make that change, it'll be that much easier.
Oh, okay. So since it is more of a process, right? Or, those opportune times, what can a client do? Like, or what can we encourage a client or maybe a family to do in regards to maybe, I don't know, having those conversations, or what's the family's role, or how does that look?
Yeah, that's a good question. It looks different for
But
different people.
I'm sure.
But I think it kind of does depend on the level of the client. So if we are talking about somebody who really needs to stop driving, oftentimes that's when the family is more involved. So
Right.
for me, kind of a little thing that I've noticed with my clients that are coming here for a driving evaluation, I pay attention to who calls to make the appointment. So if it's the adult daughter or the spouse calling to make the appointment, that tells me a little bit more potentially about that client's functional level than if the client themselves calls to make an appointment. So I think of that in terms of what you're talking about. Like, so if somebody's got a dementia diagnosis, it's probably more likely that the family is going to be involved. Or it could be not cognitive. It could be multiple chronic conditions with some vision impairment and some hearing impairment, a lot of little things to where the family maybe is saying to you, maybe not even in front of the client, saying, Dad had a TIA, he's doing better, but I'm just kind of worried about driving anyway. And I think OTs are often in that position to be the receivers of that information.
Yeah.
And I would love for us to be able to, my whole goal is for OTs and OT practitioners to take some action around this. Not that you have to make any decisions, like final decision making or anything like that. But my first request is just to not be scared of the conversation, to not shoot it down. Because I've heard so many therapists say, talk to your doctor. And that's kind of the end of the discussion. Whereas I think we can just have that, well, what are your concerns? And maybe we can talk about this with your dad tomorrow during our session. And sometimes it's easier for families to talk when there's another medical professional involved, as opposed to them just having their own conversation. So I think the family role is huge, because a lot of times they're going to leave our setting and we don't know what happens after that. And it's the family that's going to either help reinforce whatever recommendations were made, or reinforce the next level, like that they should go back and discuss this with their doctor, that they should go for a driving evaluation. So I think the family is key in, if we have concerns, understanding our concerns, and then also helping kind of preparing for the future steps.
So if you do have a family member that, says something like that, what would you recommend as an OT, starting having the conversation? Would you recommend saying maybe you need to see a driving rehab specialist, or do you say maybe you do need to talk to your physician, but we can start the conversation here? Or I feel like it gets a little bit gray, because if you're not a driving rehab specialist and you are, that your role isn't necessarily to make those those hard recommendations. Like, I feel like part of the reason it kind of gets lost in the shuffle is because we don't really know what to do with that information.
Yeah, no, I agree. And it can be an uncomfortable
a
lot of times. Absolutely. So one kind of resource that I'll mention in regard to this is it's called the OT Drive model. And it's an article. It's published in OT Practice. And I think you have the citation information for that, Mandy.
Yeah.
So it's by Alan Scholl Davis and Ann Dickerson. And it's really with the generalist in mind. So going through, it's an acronym of like, if driving is brought up, these are some things you should look at. So it's a great just guide for clinical judgment. It's really going to start with the client. What was the occupational profile? Do they have to drive? Do they, what are their typical environments for driving? All of these things matter in terms of what we're going to end up suggesting and helping with. And so I think we get a little bit caught up on driving and liability and all these things that are scary. But really, my approach, in just general therapy clinic with the clients is just talking about I'm noticing that you're having this difficulty. I'm concerned for things like driving, for things like crossing the street, for things like going grocery shopping on your own. It fits in to everything else we're doing. To me, it doesn't have to be a whole separate session about driving per se.
Like, let's sit down and have this big, deep discussion. Like
Exactly. Just identify that you are somebody that wants to hear what they think about it and that you're open to having these discussions. And I don't think we, as OT generalists, have to have the answers. We just need to start by being willing to honestly tell them what we see in our clinical judgment in terms of strengths and weaknesses and continue that conversation.
Mm-hmm. No, that's some really good insight. And I'll definitely add that in the show notes, that OT Drive Model article from OT Practice, because those are the little things I think could really help some of us that really kind of struggle in this area. So I'll make sure I add that for sure. But what happens, let's say, if maybe it's determined that the client must retire from driving because it's been determined through a driving rehab specialist. Because example, like where I live, they have to travel really far to see a driving rehab specialist. So what typically happens is they'll go through the evaluation and then they'll have some recommendations, but then they'll come back to me or whoever. And then, we're kind of doing the next step or like maybe we're seeing them for other things, not just driving. But that was one of the steps that they needed to go see a driving rehab specialist because they were, determined to drive and the family's like, nah, not yet. Right. And so, they'll be sent kind of to the specialist and then they come back. So if it is determined maybe that they are, that they do need to retire, what can we do? What are some suggestions or what are some things on how we can make this process easier for the client and help them, continue to do the occupations that are important to them, be in the community, visit their friends, go to their senior center, go grocery shopping or whatever that may be. How do we assist in that transition?
Yeah, that's a great question. And I think everything you're mentioning there are actually the really important pieces of so many people think if I stop driving, I stop leaving my house. Really, and honestly, research has shown that people who stop driving, depression rates are higher. There's a lot of negative consequences. Mm-hmm. So I think anything we can do to really support them in engagement in life, engagement in the community, and to see driving was one option, was one means to an end, and there are others out there. Mm-hmm. Just back to the OT Drive model for 1 second, because it pertains here is a big part of this model is to use kind of a stoplight, so red, yellow, green, and decide early on when we're treating somebody, do we see them in this red area, like they just have moderate to severe dementia. Driving is not a safe option for them right now. They don't necessarily need to go to a specialist for us to kind of have that discussion with the family. Uh-huh. And then green might be like the hip replacement patient that I was talking about earlier, who's doing great, is recovering well, has a temporary restriction because of an orthopedic reason, but likely doesn't need to see a specialist either. We'll go on to getting back to driving. Mm-hmm. And then that yellow is really that in between. And it might be a wide range of yellow that we see where we're like, mm-hmm. I don't know. Like some things are good, some things are bad. And so just to put that language out there, because I feel like that can help us in our discussion today, but also just as we're talking within our clinic and even talking to our patients potentially. So we're talking about these clients in the red, basically, when you're saying whether they've gone to a specialist determined red or their doctor just says your vision is not good enough for you to drive, end of story. I think that there's a huge emotional piece to that for anybody to have to stop driving. I was reading through something recently. I was saying driving transitions are really in the emotional realm, not the logical realm.
Isn't that the truth?
It really struck me because logic doesn't factor well into some of these conversations as much as we might try.
Right. That's a really good point.
So if we're lucky enough, like if that client is lucky enough to have supportive family, I think involving the family in these discussions is a really key thing that we can do. There are some great worksheets and handouts. So the Hartford Insurance, in collaboration with the MIT Age Lab, has put out some fantastic resources. One is called We Need to Talk, and the other is At the Crossroads. And they're both booklets that are free. You can download them online, really geared around having conversations about driving. But there are some great resources in the back of that. Ooh, sorry. There are some great resources in there. One of them is like a getting there guide. So it just helps list out, where does this client typically go? You know, how, and then options. And you could fill this out with them. You could give it to your client to take home to do with their family. But looking at things like, okay, doctor's appointments, a lot of times the family wants to be at the doctor's appointment anyway. So that is one that makes sense for the family to go with them too. Grocery store, you know, it's going to depend on where you are, but really problem solving in a very like individualized way, I think is a huge, there's just nobody else doing that. So I feel like
with them, is that what you're saying?
So,
Okay. Yeah.
It just fits so well into our goal of, you know, keeping them active and engaged. And they may have to rethink the transportation piece of it, but that community mobility piece is still firmly within the OT scope.
Yeah, I think those are, it's nice to have those resources, but also I think it gives a little structure to the family as well, because it is sometimes a really uncomfortable, because it's going to be a headbutt sometimes. I mean, I've seen it where, the doctor will say you can't drive, and the family's like, you can't drive. And they're like, well, I want to drive. And it's like, there's a headbutt. But if you kind of go at it from a, what's the ultimate goal? The ultimate goal is, like you said, getting to your doctor's appointments, getting your groceries, whatever, visiting your friends or whatever it may be. Like, everyone has that same goal, just how you get there is going to look a little different. So it's nice to kind of have some of those really good resources. So I'll make sure I, link some of that stuff up too, because I mean, I think, it gives a little bit structure. It's structure, and it's not just like having this uncomfortable, crazy, like, conversation. It kind of gives a guide. Right?
Yeah, because it's hard. And sometimes people will just have a handout of transportation alternatives, but I think sometimes that's hard to navigate. Different senior services may have things for certain ages, and I think a little bit of knowledge about what's available in your community can go a long way to help your client make those decisions, or maybe their family is the one making some of those phone calls. But I think too, maybe more on the emotional part, if we can help them to see, and this is where the diagnosis is key, because if there's lack of insight, we may just not be able to convince them. It just might not happen. And that's difficult. Yeah. But for some of our clients, for example, I had a patient who I was seeing not for driving, just for general OT and outpatient. And, but he really wanted to get back to driving. So we're talking about things, we're doing our different assessments. He had a stroke. And, as we start doing some of the cognitive assessments, he's doing terribly. And he was very defensive about it. Well, these don't matter to my life. That's why I'm not doing well. And, all these things that we hear.
Yeah, exactly.
And I was really concerned about him getting back to driving. And for him, I did end up contacting his doctor, but he also had some vision stuff going on. And so a while later, we were back in touch, and he came and told me that he had stopped driving because his eye doctor felt like he shouldn't drive anymore. And for him, it was such a better way to go for the physical or go for the vision deficit as opposed to cognitive, to just really, if there's something that you can focus on that's more concrete, I think that's really what it comes down to. if your vision doesn't meet this certain standard, end of story.
Right.
As opposed to, well, you scored this on this test and the research shows this.
Yeah.
Sometimes that's good enough, but for some people, they don't care.
Well,
about
and
that.
I think there's like a level of maybe embarrassment too, you know what I mean? And you're just like, I mean, you can explain to your friends that, oh, you know, my vision is bad. I can't, you know, I can't drive. And other people are like, yeah, you know, my vision's not that good either. Or I can, you know, it's like you say, it's much more concrete versus saying like, yeah, like my memory's bad, or I don't have very good problem solving, or you know what I mean? Like, I feel like this just, and it's attached to that emotional, the component. And it's just like the pride and the acceptance of where you are. And there's so much that goes into that. And then in addition to just feeling like, I mean, I've heard, you know, patients talk about how like, you know, if I can't drive anymore, then like, you know, I'm done, you know what I mean? Or it's such an identity. And I think sometimes, you know, you're talking about the different options and how I do it, which I don't know if it's always like the number one way, but it's like trying to really focus on the goals of like, what are you trying to achieve? And, I mean, I even had I had to go through and like, even try to like talk about the cost of the car. Like I've done everything where like, I'm like, you know, you have to insure it. You have to put gas in it. You have to like, I kind of went that angle. And actually it was really, I mean, like I said, it's so individualized and what drives them. And I was like, you know, the bus is this much, or you get a discount for senior and it comes right to your house. And it was like trying to find the angles and the importance, what's important to them, and working on the goals. And focus for me anyway, I found focusing on the ultimate goal. I had one, client that was like, you know, always went once a week, went to the senior center to play, I think it was pinochle, you know, with her group of friends. And it's like, you can't, you know, trying not to focus on that she couldn't drive there, but how could we achieve the goal of, you know, socializing with her friends, right? And so that was, everyone's so different, but you just find those things that are important to them. And if that is very important to them, like, you know, not that they like that they can't drive anymore, but they just want to go see their friends and do their daily or weekly routine.
Exactly. I think that's where OTs can be so helpful, because we really are focused on the big picture of it.
Mm-hmm.
And for some clients, if they had another way to get there, they would be happy not to drive. You know?
Right. That's
they may
true.
not tell you that, but sometimes they do. And I had one gentleman that I worked with, and he had even taken the test at the DMV, failed the test at the DMV, and his son called me to say, I think he's still doing okay. I think he's just not holding his hands right when he takes the test or something. So,
yeah.
Well, that's kind of concerning. But
yeah,
we went through our whole eval, and the family, I wasn't at a point of recognizing this as dementia. But to me, I was like, there's something major going on here. And we drove and we got back, and I basically told the client and the family, I don't think he's ever going to pass the test at the DMV. Like his cognitive issues are just getting in the way of these things. And the client was so sweet, and his wife was living in assisted living. And he's like, all I want to do is be able to go see my wife. Like that's the bright spot in her day. And so this discussion with his family, instead of, it had been such about butting heads and ego and all of these things, you know, finally he came to this point of like, if I just could, and I think that at that point the family is like, well, it might be best for you to move there. And then, you know, for both of you to be there. But even if that wasn't the solution, to have transportation could be scheduled to bring him every day at 3. And then both he and his wife are getting their needs met. And so it is just kind of thinking outside of how we've always done things. And I think that's where we can be really helpful.
Yeah. Oh, that's a good story too, because like you don't, because I always feel like sometimes you're always going to find that resistance, but you're right. There are some people that are just kind of like almost in a weird way relieved, not weird, but like in a unexpected way relieved.
Yeah.
over saying like, okay, like I'm done.
Because I
But
think people sometimes do have that bit of insight where they're like, maybe I'm not that safe, but they don't want to admit it because that would mean so many changes in their life. So if we can kind of find an out for them, it is a lot about kind of saving their pride and still being able to do what's important to them. And maybe that's not driving. And honestly, another piece of that for the clients that I see, a lot of times it's continuing to drive with restrictions. Can be if somebody's got like an early onset of early dementia diagnosis.
okay, yeah.
They may come and do poorly on some of the clinical testing, driving in neighborhood environments. We may drive in their environment and decide, like this one man, he drove to breakfast every day to meet his friends, 5 days a week, 2 miles from his house. I saw him over a period of a couple years, but the second time I saw him, we said, how about you only drive to breakfast? All other driving your wife does. And they were in a situation where they could do that. And what that did was give him that peace that he needed, wanted to do independently, but also let him get used to being the passenger, get used to finding other, I think of that as like the hybrid. So you have restricted driving, you're still driving some, but you're working on, and to me, that would be the ideal for retirement, is that you kind of wean out of driving, so to speak. And so for some, and that's not going to work for everybody, but for some people, maintaining that piece of getting to the grocery store and getting to church is really important. And then maybe we can find rides for some of those activities that are across town. And so it's harder to do that as a generalist, but even having some of those discussions to introduce the idea is definitely something that therapists can do.
So what kinds of like ideas, I'm just kind of like thinking, like brainstorming, like what are some examples of alternative transportation? Like I know it depends on where you live and that kind of thing. Cause like where I live, there's a lot less options than maybe like where you live. So, I mean, I can, think of the typical bus, right? And I guess Ubers, there's more options with those types of things now.
That is opening it up a bit. It can be really hard, and especially in more rural communities. So one of my favorites is called Go Grandparent. And
Go Grandparents?
Isn't that a fun name?
That is a good one.
So they have a website. You can look on their website, and they, I think, are throughout the nation. And my understanding of it, and I haven't used it personally, so I should say that, but I've talked to people who have.
Yeah.
It's kind of like a concierge service for Uber and Lyft, because an older adult would have to have a smartphone and be pretty good at using it to call an Uber to pick them up from the doctor, let's say. What this does is there's a number they can call, they can talk to a real person, but that person will still send an Uber or a Lyft basically to them. But their child could also set it up. So I could set it up for my mother-in-law to where the driver would text me when they pick up my mother-in-law and then text me when she gets home. And so it's something that the adult children can really play a role in when they're not local. That is maybe a little more comfortable to the adult than a taxi or something like that.
Right. Oh, wow. I love those innovative.
I know. I wish there were more. There are some neat ride sharing and kind of like ride banking services, but they're just in really specific geographic locations right now.
Right.
But I'm hoping that that'll change.
Well, I mean, like around here, as an example, of course, we have like paratransit, and then you have, like a bus system, and then there's a lot of like church communities that will bring a certain member of their church community to, they'll say, oh, I have appointment here. And so I think it's like getting creative and, like you were saying, knowing what your resources are in your community, or if you hear about something like that, kind of tuck it in the back of your mind or keep a list or something like that to know those options. Or like, do you have a neighbor that would be helpful? Or, you know what I mean? Like looking at all the options, because example, like the bus system over here, like literally people have to walk, across a highway. I can think of one town in particular, because there's a lot of little resort towns over where I live in Western Colorado. Like in one town in particular that, you literally have to cross like a highway, not an interstate, but like a highway to get to the bus stop. And, that's okay if you're, able-bodied, or, you know what I mean? Like,
sure.
But it was like that's not actually the bus, the transportation is actually not a usable service in that community. So they do use a lot of senior center kind of community transportation or paratransit and that kind of thing. They have a system called like the Traveler, where you can call them up. It's through like the senior center services, where you can call them up and say, can you pick me up at this time and drop me off at this time? And it's more like a van, or, like it just depends on, like, obviously someone's mobility status and things like that. But I think it's just knowing what's out there and like who their system is. Can their kids help? Can they not? Can grandkids, can neighbors, can your, religious community, if you have one? I mean, like, you have to get creative.
A lot of times people feel like they don't want to be a burden.
Oh, absolutely.
To their children or to their neighbor. But if we can kind of plant this idea of a barter or a trade, or, so it might be that you bake cookies for the person who drives you to church, and they really value that. And also letting people know that some people, it's helpful to them to have someone to go to the grocery store with. And so you're helping them by letting them give you a ride. And I think those are, again, going to be individualized, but finding some way so the person who's receiving the ride feels like they're paying them back in a sense without money per se.
Mm-hmm. Yeah, that's a great idea. That's a good way to... It's another angle. I keep using the word angle, maybe not the right word, but like just have something else to kind of say, like, okay. And that makes people feel better too about feel like they're not taking advantage, even though most of the time people are happy to help, but it's just that
very
feeling.
Much so.
And earlier you talked about, trying to have a societal mind shift of, planning ahead. And I know kind of when I was digging around on this topic, before, it's talking about like driver planning agreements. Do you want to touch a little bit on what those are and how those kind of work? Because I think that's a really proactive way about driving.
Yeah, it's an interesting one. And I've received various feedback on them. I will say.
Like, that's good. I love to hear this. Yeah.
There was actually so AAA Colorado did I think a focus group, but also a survey. And a lot of the individuals in that survey said they didn't like the idea.
That's good to know. Interesting.
I think it's still worth having. So when I think of the idea of a driver planning agreement and there is an example of one of them in one of the Hartford books. Basically something that's an agreement, and I like the ones that go both ways. So the older adult identifies who they would want to tell them when it's time to stop. And the child or whoever else is involved says, I will do everything I can. I will, we will explore resources, whether you need a different medication or whatever it is, to keep you driving as long as possible. So both parties are kind of saying, we're committed to you driving as long as it's safe, but when it's no longer safe, to coming up with an alternative. And just having that in writing can be really helpful for the family member when it comes to that point, but also helpful for the older adult to be a part of that process and not feel like their kids are conspiring behind their back or something.
Yeah.
So that's what I really like about it.
But there was mixed review or mixed usage.
And these are people who hadn't done it, but then when they were presented with the topic, they were like, oh, I don't know about that.
I thought it sounded, I mean, I've never used it or anything, but I thought it was kind of interesting to kind of like learn about it. Cause I was like, but you have to have a proactive kind of family, but I mean, but it could be just a part of like your like financial, or, if you're getting everything kind of situated, right? Like finances and I don't know. I just thought, oh, that's an interesting concept.
Yeah. And I think that just back to that kind of bigger picture of, I mean, I think it would be great if primary care physicians were just checking in about driving, not after a stroke, but just at the annual physical. How are you feeling about driving? And so same with OT visits. So how's driving going for you? Like, just for it to be something we talk about, I think would be huge. And then also, as much as OTs can be advocates for community transportation and options for older adults, and our kind of one bottom line is that our societies, we rely on older adults to be members of our society, buying things in our community, all of these things. So it benefits all of us to keep all members of society engaged in our community. And I think it's going to take all of us to figure out kind of the best solutions to that. But we can start by having the conversation, I feel like.
Oh my gosh, that is a perfect. I was gonna say, what are some key takeaways? But I think those are perfect key takeaways.
I jumped ahead of you.
You can read my mind. See, OT driving unicorns. No, I just love that, because I do think that it's such a area that I know I personally kind of like said, oh, here are some options, but I didn't really maybe even integrate it into some like goal setting, which I think we can absolutely do, like really, really work on it instead of just, I don't know. And maybe some people are way better about it than I was when I first started learning about it, but
I think not.
Yeah, well, good point.
There's a lot of just unfamiliarity and hesitancy about it. So I think any of that, but yes, working in alternative transportation into goals is great. Great idea.
Yeah. Well, I mean, because like I said, like a lot of times it'd be like, oh, here are your resources. This is what you can do. Here's my little sheet on it. You know what I mean? Here's my little handout. Give it to the family. But then, I know in the past, it's like not doing a follow-up or like problem solving or like making sure that they have the conversation because maybe they don't want to and they need a healthcare professional to actually initiate that or follow through on some of those things. So I think those are really, I think this has been a really great conversation, and it gets my mind going. I'm thinking about like how we can, in my own community, how that looks, because it is so individualized. But I appreciate you being here today and chatting with me all about driving retirement. It's so fun. I love it.
It is great. There's so many good things to talk about, and thank you for your interest.
Oh my gosh. I totally nerd out on I love these topics when I kind of like, ooh, this is something that I'm not very good at. And then I like really love digging in and the research and
to me, it's so meaningful to our clients. So, I mean, to me, it gets to the heart of why we're working with our clients. So absolutely. I think it makes a lot of sense.
Definitely. Well, thanks again, Terri. Thanks for sharing your expertise and passion about driving today.
Thanks so much, Mandy.
Oh, and thanks everyone for listening. So until next time.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all the treatment ideas, patient handouts, clinical resources, community support, and mentorship you need to succeed. Join today at seniorsflourish.com/learninglab.